hospitals, patients place their lives in the hands of nurses. These caregivers are often the unsung heroes, the first to comfort the sick, the last to leave a patient's side. They administer medicine, wipe away tears, and bring hope in the darkest moments. But what if the person meant to heal was quietly killing instead? This is the chilling story of Charles Cullen, the nurse who became one of the most prolific serial killers in modern medical history. A man who, under the guise of compassion, left a trail of death across multiple hospitals. His crimes shocked the world, not only because of their scale but because they revealed terrifying gaps in the healthcare system meant to protect the vulnerable. Charles Cullen was born in New Jersey in 1960, the youngest of 8 children in a troubled working-class family. His father died when Charles was an infant, leaving his mother to raise him and his siblings alone. His childhood was marked by instability, bullying, and feelings of isolation. By his teenage years, he already displayed signs of deep emotional turmoil. When his mother died in a car accident during his senior year of high school, Cullen spiraled further. Shortly after, he enlisted in the U.S. Navy, hoping for structure and belonging. But he struggled there too, enduring constant hazing. He was eventually medically discharged, carrying with him growing resentment and psychological scars. Searching for a new purpose, Cullen enrolled in nursing school. He seemed to have found his calling, caring for patients, offering relief, and stepping into a respected profession. By the late 1980s, he was working as a nurse in hospitals across New Jersey and Pennsylvania. To colleagues, he was quiet, even awkward, but dependable. To patients, he was just another caregiver in scrubs. But beneath the surface, Cullen harbored darkness. It began with small acts of tampering. Cullen started administering drugs not prescribed to patients. His weapon of choice was digoxin, a powerful heart medication that, in high doses, could stop a heart completely. He also used insulin and other drugs available on hospital wards. His method was chilling in its simplicity. He would inject a patient's 4-bag with a lethal dose, walk away, and let death take its course. First, no one noticed. Hospitals are places where people die, after all. Elderly patients, the terminally ill, and those with chronic conditions were Cullen's primary victims. When they died, it seemed natural. Families mourned, doctors signed off on the deaths, and life went on. But the deaths kept piling up. Between the late 1980s and early 2000s, Cullen worked at least 9 hospitals and a nursing home. Each time suspicions arose, he left quietly and found employment elsewhere. Hospitals didn't report him to the authorities. Instead, they quietly pushed him out, afraid of lawsuits, scandals, and damage to their reputation. This practice became known as passing the trash, moving a problem employee rather than confronting the danger head-on. Patients kept dying. A pattern was forming, but no one put the pieces together. Cullen himself later admitted he felt addicted to killing, describing it as a compulsion. He claimed he believed he was easing suffering, that he was acting mercifully. But in truth, many of his victims were not terminally ill. Some were even recovering. His so-called mercy was nothing more than murder. By the 1990s, whispers began circulating among his colleagues. Nurses noticed unexplained deaths, sudden cardiac arrests in stable patients, and medications missing from stock. In one hospital, security cameras caught Cullen entering supply rooms at odd hours. At another, a pharmacist flagged suspicious drug withdrawals. Still, administrators hesitated. Cullen was always allowed to resign quietly and move on. He was never formally reported to the nursing board or police. Each hospital's silence gave him freedom to kill again. By the early 2000s, Cullen had killed dozens of patients. Some estimates place his total victims at over 300, making him one of the deadliest serial killers in history. The case finally unraveled at Somerset Medical Center in New Jersey. In 2003, Cullen was working in the cardiac care unit. Nurses noticed a spike in deaths among patients who weren't expected to die. Lab results revealed abnormal levels of digoxin and insulin in their systems. 2 colleagues, nurse Amy Loughren and hospital security staff, grew deeply suspicious. Amy had worked alongside Cullen and even considered him a friend, but she couldn't ignore the red flags. With mounting concern, she began secretly cooperating with detectives. Police set up surveillance, and Amy wore a wire to record conversations with Cullen. In chilling exchanges, he admitted his role in patient deaths, though often in vague or evasive terms. Investigators gathered enough evidence to a CT.in December 2003, Charles Cullen was arrested. The trial revealed horrifying details. Cullen confessed to killing at least 40 patients, though authorities believe the true number was far higher, possibly more than 300. He described slipping lethal doses into 4 bags, watching patients crash, and calmly walking away. His demeanor in court was cold and detached, as if discussing routine tasks rather than murder. Families were devastated. They had trusted hospitals, trusted nurses, and trusted Cullen himself. Now they faced the reality that their loved ones had been deliberately killed by the very person assigned to care for them. Cullen pleaded guilty to multiple counts of murder and attempted murder. He was sentenced to multiple life terms, ensuring he would never walk free again. The case left scars far beyond the grieving families. It exposed major flaws in hospital oversight. Why had so many institutions ignored the warning signs? Why had they let Cullen slip away quietly instead of sounding alarms? The scandal forced hospitals to re-examine their hiring practices, reporting standards, and accountability measures. Cullen himself gave conflicting motives. At times, he claimed he wanted to ease suffering. At other times, he admitted he couldn't stop himself, that killing had become an uncontrollable urge. Experts suggested he might have been driven by a mix of psychological trauma, a need for control, and a distorted view of mercy. Regardless of motive, the damage was done. Hundreds of lives had been cut short. Families never received closure, and the medical profession was left with a permanent stain. The story of Charles Cullen is not just the story of one man's evil. It is also the story of systemic failure. Time and again, hospitals chose silence over confrontation, reputation over responsibility. And time and again, patients paid the price. Cullen may have been stopped in 2003, but the lessons of his crimes remain urgent today. Oversight, transparency, and accountability are essential to prevent another predator from hiding in plain sight under the cover of a nurse's uniform. Charles Cullen will spend the rest of his life behind bars, but for the families of his victims, no sentence can erase the pain. Every hospital bed he touched carries the memory of betrayal. Every 4 line he tampered with represents a life stolen too soon. He was meant to save lives. Instead, he turned hospitals, places of healing, into his personal hunting ground. And so, the next time you step into a hospital, remember the story of the nurse turned serial killer. Remember Charles Cullen, the man who shattered trust in the very system designed to protect us. His story is a chilling reminder that evil can wear scrubs, carry a syringe, and smile reassuringly, even as it takes life away. If you found this story shocking and want to hear more chilling true crime cases, make sure you subscribe to the channel, comment what you think. Hit the bell icon so you never miss when we uncover the darkest stories hidden behind ordinary faces. Because sometimes the greatest danger comes from those we trust the most.